Good evening and welcome to Lorain County Board of Commissioners. It's Tuesday, November 14th, 2023. Please rise for the Pledge of Allegiance.
And to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Commissioner Moore?
Here.
Mr. Riddell?
Here.
Commissioner Hung?
Here.
We have a quorum. Under resolutions number 1, investments.
So moved.
Second.
Discussion. Commissioner Moore?
Aye.
Mr. Riddell?
Aye.
Commissioner Hung?
Here.
Number 2, appropriations.
Yes. Sorry, I meant yes.
These are
Yes.
today's appropriations. Any discussion? Seeing none, move to approve.
Second.
Discussion. Commissioner Moore?
Aye.
Mr. Riddell?
Aye.
Commissioner Hung?
Yes.
Number 3, transfers.
These are tonight's transfers. Move to approve.
Second.
Discussion. Commissioner Moore?
Aye.
Commissioner Riddell?
Aye.
Commissioner Hung?
Yes.
Number 4, advances and repayments.
Move to approve.
Second.
Discussion. Commissioner Moore?
Aye.
Commissioner Riddell?
Aye.
Commissioner Hung?
Yes.
Number 5, requisitions.
We have 5 pages tonight. This is page 1 of 5. Any discussions? Page 2 of 5, please. Three of 5, please. And page 4 and page 5. And these are move to approve pages 1 through 5 of the requisitions.
Second.
Discussion. Commissioner Moore?
Aye.
Commissioner Riddell?
Aye.
Commissioner Hung?
Yes.
Number 6, travel.
Move to approve.
Second.
Discussion. Commissioner Moore?
Aye.
Commissioner Riddell?
Aye.
Commissioner Hung?
Yes.
Number 7, bills.
We have 8 pages tonight of our bills. You can see us all shuffling a lot of papers up here tonight. This is page 1. Page 2, please. Page 3. Page 4. Page 5. Page 6. Page 7. Page 8. Move to approve pages 1 through 8.
Second.
Discussion. Commissioner Moore?
Aye.
Commissioner Hung?
Yes.
Commissioner Riddell?
Aye.
Number 8, commissioners may recess an executive session to consider the appointment, employment, dismissal, discipline, promotion, demotion, or compensation of a public employee or official.
Okay, I have the personnel summary sheet. I move to approve the personnel summary sheet.
Second.
Discussion. Commissioner Moore?
Aye.
Commissioner Riddell?
Aye.
Commissioner Hung?
Yes.
Public comment on agenda items? I'm not sure that.
Does anybody want to speak in regards to anything on the agenda tonight? Okay. We'll have some public comment at the end, so you can,
We had a hand up.
oh, we did have a hand
I
up?
just saw a hand.
Well, yeah, if it's in regards to something on the agenda? We have the agenda in front of you? It's not on the agenda. No. Yep. That's why I saw you had it on there for healthcare, so I figured it'd be at the end, so.
Is there any old business? No. Board business. Number 9, approve and waive the reading of the Commissioners' meeting minutes of November 3rd of 2023.
Move to approve.
Second.
Discussion. Commissioner Moore.
Aye.
Commissioner Roydell.
Aye.
Commissioner Hung.
yes,
Job and Family Services 10, authorized purchase service agreement with Go Green Landscaping LLC, Oberlin, Ohio, in the amount of $40,000 for snow plowing and salting services. This is effective retroactive to November 1st of 2023 through May 1st of 2024 and will be paid out of Public Assistance Administrative Fund account.
Move to approve.
Second.
Discussion. Commissioner Moore.
Aye.
Commissioner Roydell.
Aye.
Commissioner Hung.
yes,
Sanitary Engineer 11, authorize the issuance of not to exceed $1,100,000 water system improvements for North Ridge Road project, bond anticipation notes, Series 2023B, for the purpose of paying the cost of constructing and acquiring water system improvements for North Ridge Road project, together with all necessary appetances thereto.
Move to approve.
Second.
Discussion. Commissioner Moore.
Aye.
Commissioner Roydell.
Aye.
Commissioner Hung.
yes,
12, authorize the issuance of not to exceed $1,430,000 water system improvements for the Broadway Water Main Project bond anticipation notes, Series 2023B, for the purpose of paying the cost of replacing existing 6-inch water mains on Broadway between North Ridge Road and East 39th Street, Sheffield Township, with a new 10-inch PVC main, including new hydrants, service connections, and pavement resurfacing, together with all necessary appetances thereto.
Move to approve.
Second.
Discussion. Commissioner Moore.
Aye.
Commissioner Roydell.
Aye.
Commissioner Hung.
yes,
13, authorizing issuance of not to exceed $620,000 water systems improvements for the Grove Avenue Waterline Project bond anticipation notes, Series 2023B, for the purpose of paying the cost of replacing the existing 6-inch water main on Grove Avenue in Sheffield Township with a new 8-inch PVC main, including new hydrants, service connections, and pavement restoration, together with all necessary appetances thereto.
Move to approve.
Second.
Discussion. Commissioner Moore.
Aye.
Commissioner Roydell.
Aye.
Commissioner Hung.
yes,
14, consolidating the 3 bond anticipation note issues of the County of Lorain, Ohio, into a consolidated bond anticipation note issue and establishing the terms of such consolidated issue.
Move to approve.
Second.
Discussion. Commissioner Moore.
Aye.
Commissioner Roydell.
Aye.
Commissioner Hung.
yes,
Engineer, 15, accept on behalf of Columbia Township trustees the improvements of Emerald Woods Subdivision Number 6 off North Boone Road. Engineer, accepted the public improvements completed by EWGC Development Company, Development Group, LLC, subdivider, and the roads will be dedicated as recorded in Volume 113, page 21 of the Lorain County Records of Plat as follows. Wally's Way at Township Road T345 at 0.069 miles in length, present termini to the west termini, and Annabelle Drive, Township Road T355, 0.131 mile in length, present terminus to Wally's Way.
Move to approve.
second,
Discussion. Commissioner Moore.
Aye.
Commissioner Hung.
yes,
Commissioner Roydell.
Aye.
County Administrators update.
We have a couple presentations during my time. Healthcare with us, we've got Brad Cogan and Steve Parsons, our actuary. They're here to give us a report regarding a premium increase for the county for our healthcare plan. It's important to remember that this is independent of the plan changes presented on October 31st. And if the county decides not to leave the grandfather status, and you're going to hear Steve say that he's still going to recommend that there'll be a premium increase. And we all must remember that the county has not increased the rates for the past 3 years. In other words, there has been a zero increase, even though inflation has basically run out of control. But there has not been an increase to our employees for the last 3 years. It's been held at the present rate. And there's a actual need, when you hear Steve go through the actuarial side, for an increase to happen this year, or actually in next year, in order to keep enough funds available to cover all the claims. The county has control of the increase. If they decide to move forward with this process, Steve will give us a presentation as to why it's needed. And we don't want the system to diminish over the next 10 years as it has this last year and it's close to about $6 million that came out of the fund this year. I think, Casey, is that correct?
Yeah, yes.
So the fund is actually, the funds that are available has been reduced 6 million. So Brad and Steve, could you go ahead and, yeah, sure. Brad's been with us since 21, and I think Steve Parsons probably has been here for, how many years?
15 years.
15 years? Go ahead.
So Brad Cogan with Minutemen HR, Steve Parsons with Chelco Consulting. I'm here just to ask if there was any questions on the presentation from October 31st as far as leaving the grandfather status. I know everyone's had time to now look at that. Basically, the moral of that story is if we decide to leave, the county decides to leave grandfather status and make those plan changes and add those coverages, there's approximately a $340,000 decrease in the claims fund. So it's pretty much making those changes is, from my perspective, is pretty much a win-win for the county and for the employees. And then Steve's going to speak to the actuary. So the actuary's function on a self-funded plan is basically to protect the funds and make sure that the plan can continue to run moving on forward basis. But like Administrator Armbruster said, the other thing about being self-funded is that after you listen to the actuary presentation, you can kind of decide the best way to go about increasing premium over the next couple of years. It is in the group's control, but the actuary does give the number on where the rate should be so the fund has enough money to pay the claims. Does that make sense? Steve?
So to start my process, or the first table here, basically I have two roles for the county that I serve during a given fiscal year. The first role is one that's required by Ohio Revised Code Section 9.833, just to assure that you had enough sufficient assets to cover your incurred but not reported liability. So what your liability at the end of each fiscal year, do you have sufficient reserves? And that's what item 1 is, and confirms that you have sufficient reserves. That's required by state law. The rest of my report, as Jeff and Brad have said, is an independent actuarial forecast of what we believe the claims will be next year. We know that there's not a perfect number. We know it's likely a range, but we go through a process to forecast the claims for 2024. It's consistent with prior years and how we've set the forecast using the same methodology. We look at 2 years of actual claims experience of the county and your enrollment, and basically comes up with a per employee per cost for the last 2 years, and we trend that forward using healthcare assumption on inflation for medical at 6 or 7%, excuse me, and prescription drugs at 9% inflation to get to our forecasted claims costs. Also built into this is the fact that we've not had increases over the last few years. Had we been doing that, we would probably be looking at about 8 to 9% increase. So for this forecast, what I provided is Table B is the large claims summary. I like looking at that as the actuary to see what are the claims that are being incurred. You know, the large claims are the ones that are driving the bulk of the cost. You know, the typical scenario, 20% of the people that drive 80% of the cost. It's consistent whether you're a public or private employer. But it's important to look at Table B because it provides insight as to what I call the mega claims, which would be claims over 500,000, which your stop loss covers, and then claims between 100,000 and 500,000 that are not covered by stop loss because you have sufficient reserves. So the county has chosen to have sufficient reserves to take on more risk, which reduces your fixed costs. So, and that has been working over the last 15 years, in which you can take on additional risk because you have the assets to incur those claims should they occur. But you can see in Table B, those little big claims between 100 and 500,000 have increased from 5 million to 7.7 million, the most recent snapshot ending in July of '23. Table C is just provides historic look back as to what the claims have been for the last, looks like 15 years or so. That just allows, as I'm doing the underwriting, to see what the trend is. I don't use all 15 years, I use the last 2 years, but also helps when I sit down with the county administrator to talk about budgeting and where the claims have been. Most notably, you know, we see prescription drug costs increasing at far in excess of what medical costs are. Going back to the first date there, it was over a little under 6 million. Now we're projecting over 11 million for the upcoming year. And then Table D provides the detail how we complete those calculations using the last 2 years of experience for medical, drug, dental, and then vision is fully insured to come up with the forecast. The forecast is recommending 17.5% increase. And I'm here to help you make decision whether to do something different or that number, so.
Yeah, we don't have to do it. That'd be too much of a hit in 1 year. We can actually spread this out over 3 years if we wish to, right?
Well,
And that
so-
would be the decision of this board, correct?
Yeah, so the decision is the board's.
Okay.
I'm here to answer any questions you might have. So, you know, if the question is if we do 8%, what could that look like for the following years?
Okay.
From next year.
Yeah, 'cause I think seeing 17.9 in 1 year is a shocker for people, so,
Yeah, I don't take it lightly.
yep.
President, could you explain the term, the IBNR?
Yes. So at the end of any given fiscal year or plan year, you have claims that have been in, somebody's gone to the doctor in December, but the claim hasn't been paid yet. So those would be claims that have been incurred, you know, people actually have gone to the doctor or hospital, incurred those claims, but they haven't been paid. So it's the, what we would call the incurred but not reported claims, or the run out. It's typically between 9 and 11% of your expected claims.
And do we fall in that range?
Yeah.
It usually takes 2 to 3 months for a claim to get, by the time it gets adjudicated from the date of service to the time Lorain County pays that claim, it usually kind of is in no man's land for about 2 to 3 months. Some go faster, some go slower, but that's about the average.
Anything?
I would like to add, we do an actuary study every year, is that correct?
Yes.
So last year, Commissioner Hung, when we were speaking this afternoon, she asked if we, you know, if she knew that we had done one last year, when we should have increased 7.9% this year, but we chose not to do that. So that's the third year of the zero, and that's why it's up. So if you look at it, the 3 years, and you add this in, it would have been a 4, 4, 4, and a 4, almost. And if you look at the history, it's 4, 8, 4, 6, 6, 7, then 0, 0, 7, 9 was, if you look at the 7, 9, it would have picked up the 4 and the 4. So to stretch it out, I mean, you can stretch it out when hopefully we can talk in the next 3 days and put this hopefully into bed this coming Friday, as we've got changes that we have to make. So they're available, we're available to anyone that would like to discuss this further between now and if not, we're into December. Into December. But to do nothing, and you already 6 million that came out of the fund this year, we need to do something for next year, and we're all gonna pay it. I mean, the employees, I am too, but we can't just let it just diffuse and go away. I mean, inflation's here, it's not here to stay, hopefully, but it certainly is something that we all lived at the grocery store and we all lived at the gas stations.
I think it's also important to point out, and just Steve does this for a lot of groups, that 2021 with the pandemic was a pretty common 0 year for a lot of self-funded plans. So that year doesn't stick out as much because everything that happened in 2020 with employees at home and that whole year, it was pretty common in 2021 for a self-funded group to say, we're going to wait till next year and kind of see how this all plays out. It's really the following 2 years when we didn't do increases where it really started to catch it up to where we are now.
Were claims lower that year? I'm just asking overall.
Good question. People stopped a lot across
A lot of
across
hospitals
the
were
country.
stopping
We
a lot
see it
of-
because
yeah.
people were delaying
Correct.
surgeries and stuff.
Okay.
I had a few questions. To your question, Commissioner Moore, if claims were lower in 2020, I'm just looking at the MMO here for 2020. It's $25,700,000 and $21,000. So I'm looking at a 5-year average here from 2018 to 2023. So it seems like between 18 and 22, 2018 and 2022, we stayed pretty consistent, pretty much $1 million either way, with our claims between 26.5 and $28 million. Are we agreed on those numbers, Mr. Parsons?
Yeah, it's presented on table C there.
So we had a jump in 2023 to 33 million, and seems to be the 6 million number. Did you say 5 or 6, Jeff?
6.
6. So my question to the administrator today was to ask KC to break out those numbers, because what we did was we had, in 21, we had passed where healthcare could start at day one for incoming new employees, and then that had been removed, and then it had been added back on, I think it was this year, because as we know with the sheriff's department, it's used as a tool to recruit and hire, and other elected officials are using that as well. So I guess my question to Administrator Armbruster to ask KC, how much of that $6 million jump was in those first 30 days, because we made that change? I gave you lead time today on that today, guys, that I was gonna ask
I
that
mean-
question.
I think it'd be very difficult to, and Casey and I have talked about it, but, and Karen and I too, and it would be, I don't know how we do that. Can you help us? You're the actuary.
So the plan was changed to being covered day one.
Correct.
And what had it been?
30 days.
30 days. I wouldn't anticipate that being material.
I'd be interested in that number, if we can run that down. Did it cost us $1 million? Did it cost us $500,000? I'd be interested to
Yeah.
know what the difference was.
We could take a look at the number of employees that were hired in the last, between the last 12 months. And we know what number that is. I mean, we can get that number and put a healthcare cost to it.
It
I
actually
would
was
assume
since
that-
21, Administrator, because it was started in 21.
So you want to go back 21,
Well, I would just be
22?
interested how those numbers, because if you look on here, we were at 28. It's so small on here, 28 for 21, and then 22 was 28 million, but then we see this jump to 33 when you get to 2023.
We could take a look, and JR can have his staff take a look at the new hires, whether it's family or single, from 2021, and until now, on a yearly basis, and then see if we can put some numbers to it.
I'm sure you guys should be able to pull
And,
those
and,
numbers
and we'll
out.
pull that together and be
Yeah.
able to report back out.
Okay,
Now,
Is there a second set of numbers floating around? Because I heard 33 million and I don't see,
I don't see that either.
I don't see that
I
on the
saw it.
paperwork that I'm looking at.
I thought,
It's not on here.
can you put it back up,
yeah, you had it.
Victor? I thought it
Table
was
C.
right there on table C under MMO 24 projection. That's what it is. It's the projection for 24.
33,208.
It's going from 28 million in 22 to 32 million. And then you guys have 33,208 underneath that.
He's there.
Yeah, because the figures I looked at in preparation for today's meeting showed us in 17, 18, and 19, we ran 24, 25, 25 essentially in $1 million of medical claims. And of course, there's all the prescription and dental and stuff that goes with that. But at the end of the day, we come back from the pandemic in 20, and all of a sudden, it's 29 million, 27 million, 29 million again. So there's those 2-3 year periods have a difference. But what I see is, I thank you for the table that shows the actual claims. In several of those years, the claims were actually reduced, but the dollars paid were increased, which tells me that that's the cost of the care or the inflation. So it's not a matter of our people using the insurance, it's what it's costing per use. And I don't know if I want to actually go to Las Vegas and bet on doctor bills going down, but I think that when I see your increase, what it does is it makes up for the fact that every year for 3 years, the cost of every procedure went up and up and up. We didn't bank any more money, and eventually, if we continue to do that, we're gonna run to a point where we can't pay claims.
Correct. That's correct. Yeah.
Mr. President, so I don't disagree with anything that Commissioner Riddell just said, because there is inflation in the cost of the procedures and everything that we go to the doctor for and go to the hospital for, those costs go up. I don't disagree with that statement. But we are talking about that the premiums haven't been raised for 3 years, is that what you're saying, Steve?
That's right.
And then Brad talked about last week, and then an email went out about his proposed changes. So I actually have a two-part question. The first part, Brad, you may want to answer for me. On all the changes that you put out in your presentation that JR so kindly sent out to all the employees, right, JR? Was all of those changes notwithstanding, so let's just take out the emergency room increase from $25 to
Yep,
$3.
yep.
So if we made all of those changes, would that still allow us to be in grandfathered status?
No, so
So
once you
what
make.
So everybody understands, employee-wise, besides the emergency room, what changes would take us out of grandfathered status?
So I'd have to look at them all on an individual basis. I'd have to double check with the carrier and their legal, but most changes on their own would make the group have to leave grandfather status, because we've looked at this over the years. And it basically has to do with how much the change affects an actuarial shift in the claims projection. And most of the changes, they really, the whole idea with the grandfather was to basically, I don't want to say no changes, but they basically have it so you could make very, 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 very minimal changes without having to leave the grandfather status. So I can go back and check those all on an individual basis. But it is important to remember that the leaving the grandfather status, the one thing that triggers when that happens is you have to change preventative to 80 to 100. That's the grandfather change. So the other changes, the adding cardiac rehab, the ER, those are, I'm going to call those group choice changes, where you can change those, not change those. But by changing one of those, like the ER or the other ones, it would require you to bring the 80 to the 100, which is what is the leaving of the grandfather status. So all the other ones outside of the 80 to 100 have nothing to do with a change you have to make for leaving grandfather status. The only thing you guys have that's not compliant in your plan when you leave grandfather status is preventative has to be covered at 100%. And today it's at 80. So if the answer to your question, Commissioner Hung, is when I check with the carrier that changing cardiac rehab would make the group leave grandfather status, that would mean you could change cardiac rehab, but you'd have to take everything from 80 to 100%. And you could not change anything else, because they're all kind of independent of each other.
So, but to summarize that, what you're saying is that the grandfathered status kept us at a plateau where the employee paid, or the plan paid 80% and the employee had to pay 20.
And that's yes, that's correct,
So that
Commissioner.
was good for the plan's reserves, but the employees, so some of these changes leaving grandfathered are an additional benefit to the employees because now it's 100%.
You got it. So basically, you're one of the few groups left in probably the state that has not left grandfather status. So most people living in Ohio or living in America are on a plan where all those are covered at 100%. Because if they've left grandfather status, which most of them have, they had to make that change, whether that was 80, 70, 90, 98, whatever it was on their current plan. Your current plan, it happened to be 80% back in 90s. And the grandfathers, the real thing with grandfather status back in 2010 to 2012 was the federal government passed Obamacare, and they came out with all these rules. And self-funded plans, they kind of sat there and they said, well, that stuff might put us out of business, taking that from 70 to 100 and covering all these procedures that we covered at 80% before. So it was a protection at the time to say, okay, what does this stuff really cost? And over the years, people have started to realize that preventative approach that the government took towards healthcare didn't really cost plans a lot. There's a little bit of a upcharge for that to go from 80 to 100 because you guys are now going to be paying 100% instead of them paying 20. But when you're talking about $40 million, $45 million in annual spend, it's a pretty small amount. And yes, it's employee positive. That change that would have to be made is employee positive.
And it's healthcare positive because you're paying 100% for preventative
Right.
instead of 80% after the fact.
Right. So that was the idea. But we just present this, and if the county isn't ready to leave grandfather status, then you want to hold on to that, you can. Once you leave grandfather status, there's no going back. But like I had mentioned before, there's very few groups left standing with the grandfather status at this time because they've had to make another plan change or whatever the reason was.
Well, with the grandfathered status, we could have stayed in grandfathered status as long as we were under the 5% premium increase annually. So we could have been doing that over the past few years and still
Correct.
stayed in grandfathered status. So because of that, we're going to have a bigger jump in premiums for employees, which will take us out of grandfathered status. And I understand, Commissioner Riddell saying that it's a good thing because you get to 100% of your preventative services and preventative drugs, but there are also those employees that would rather have the more basic plan. So are we going to be able to offer two different plans? One is where they can stay on a plan that's in grandfathered, or they could choose the new plan, which is going to have the higher deductibles.
You can't do that.
So
But
so
I
you're
guess I
telling us
don't
you
understand.
You can't offer two plans. That's what I'm asking you.
No, you can offer two plans, but you can't offer a grandfathered plan and a non-grandfathered. So the grandfather status is basically a stamp on your group. Your group is grandfathered. This plan's grandfathered. When you decide to leave that or make enough changes, then the plan is no longer grandfathered. But you cannot offer a grandfather. You either have to stay grandfathered or leave grandfather status.
But Brad, I want to make sure. So the county, what you're saying is the county can't keep its grandfathered PPO plan and then add a high deductible plan, that there can't be two? Is that what you're saying?
Oh, well, that's a different question. So you can stay grandfathered on your current plan and keep it as it is, and yes, you can add a plan next to that, and your whole group would be grandfathered. That's true.
Okay. So which leads
Yes.
me to the next question. So have you guys prepared a summary plan description in writing? Because I haven't seen that yet.
So you guys have a current that's a good question. So you guys have a current SPD, summary plan description from 1999. The carrier will update that when the decision to leave grandfather status occurs and we start implementing the plan changes is when they would create the new SPD for the new
So-
plan.
That leads me to the next question.
Mm-hmm.
If we do that, when does that have to be, what's the deadline that has to be turned in?
So that's a very good question. So the two separate things going on here, so the leaving grandfather status and then the premium increase, which is separate. The more time-sensitive piece is the leaving grandfather status, because when that's decided on, we then have to go through the work, and it's not a big deal, but we go to the carrier, we work on the new SPD, we're gonna wanna communicate that to employees, you've got open enrollment. There's a lot of moving parts when you leave grandfather status. The premium increase affects payroll deductions going into next year, since we're talking about a premium increase for 1/1 of '24. So if the decision on that took a little bit longer, to answer your question, Commissioner, it's not as time sensitive, but you do need to tell the employees, what the decision is as far as what's gonna happen to their premiums. But the more time sensitive is the decision on the grandfather status. So if you guys come and decide, okay, we want to stay grandfathered, that's okay, then the decision on the premium will still have to take place, or vice versa.
Can I have one more follow-up? So I guess the question I have then is, because I was reviewing the MMO contract, and it says we have to have this SBC has to be submitted to them 60 days ahead of time.
Yeah, so that is true
how do
throughout
we
the
do
year.
that for
So
January?
when you do the changes on open enrollment, the 60 days does not apply. So I already checked that with the carrier.
Okay.
So you have to give employees a 60-day notice on plan changes, good or bad, when you make a plan change mid-year. So if we go back to June and we weren't grandfathered and the cardiac rehab case comes up and we say, hey, we want to cover cardiac rehab, we don't want to wait until January. At that moment in time, we would then have to give the employees a 60-day notice that that's coming in September and changing. You do not need to do that 60 days for the open enrollment period of the plan.
Okay, but we could have covered the cardiac rehab and stayed grandfathered, correct?
So when I checked that a couple years ago, the answer was no, but I can check that with the carrier again. I'd be happy
I
to
thought
check
you
on
sent
that.
us an email on that. Maybe I'm not
Yeah,
remembering.
I believe 2 years ago when we looked at it, they said you couldn't make that change, but I will double check that for you.
Okay, good.
Yeah.
Well, thank you for answering all those questions.
No, those are
Brad.
good, these are good
Firing at
questions.
ya.
These are good questions.
Well,
yeah.
and then I think you're gonna have you reviewed the CBAs to see how it affects that?
So we've worked with the team on that, and we've been told that the changes are good to go from a collective bargaining. That's what we've been told.
Who told you that, Brad?
Oh.
The contracts are written. I mean, it's all there. I mean, we're not changing the contracts. Contracts are the contracts. The changes in the contracts are gonna stay the way they are, the way they're written now, the way they're agreed to, the way they're voted in. We're looking at the healthcare side. And honestly, Brad, I think that, this is 1999 that this was put in place. It's more than cardiac rehab that what we're doing. Could you go through the list again as to what is happening and what was sent to every employee for the county? Because in here, there is substantial, we went from 24 years of 1999 to 2024, and we went beyond what we took the gold plate, quite honestly, and people are going to really get some help for diabetes, maternity, asthma, COPD, heart management. We've really embraced this to make it. Brad, could you go through the list again? Do you
Yeah,
want
so-
the sheets that you gave me here, or do you have them?
I have them in front of me.
Okay.
So once again, the grandfather changes are the preventative changes that we went over on October 31st. So that's basically changing mental health. Well, mental health has to change even if you stay grandfathered. So that's been going on, JR. So mental health has been allowed to stay grandfathered in, and now mental health has to be treated like physical health. That's just a law. So going into 24, whether you stay grandfathered or not, bullet number 1, mental health has to change and be treated the same as a broken leg. But everything else, education, training, healthcare reform, preventative benefits, family planning, immunizations, physical exams, preventative testing, and well child care up to age 21 would all be changed from 80 to 100% for employees. And then the additional changes, which I call the group choice changes, would be adding cardiac rehabilitation to the plan, adding occupational therapy to the plan, adding chronic condition management to the plan to help with diabetes, asthma, maternity, COPD, and heart management. And then there was the discussion to change the emergency room copay, obviously due to the fact that you have a $25 emergency room copay, which is leading to hundreds of $1,000s of non-emergency claims. So that's why that one is on here as well. And then the last two would be to add a high deductible plan, which Commissioner Hung is correct. You can add a high deductible plan in either scenario. So you can stay grandfathered and add an HSA plan, or you can leave grandfather status and add a plan next to that. And then change specialty drug from pharmacy to mail order, because that saves the county about I don't want to say the number wrong. There's an estimate of about $446,000 in savings to have the specialty drugs come through the mail instead of via the pharmacy. And that's usually your top 5 to 8 drug utilizers. That affects a small amount of people. So
And-
those are all the changes we've discussed. But once again, these are choices. So you can, leave grandfather status, add cardiac rehab, not add occupational therapy. I mean, you're a self-funded plan, so everything's in your control except a large change that makes you go from 80 to 100%. That's the only thing that's not in your control when you make too big of a move. Everything else is county choice. And if you don't make big changes, you can keep that at 80% by staying grandfathered.
And the specialty mail order is therapeutic value of what I order from our mail order is the same as getting it from the pharmacy. Is
Right.
that correct?
If
The
it's
same drug.
cold, it'll come, right, correct,
It just comes in the mail rather than going to the pharmacist.
correct.
Not the same pharmacist, but a pharmacist takes care of it. So, any other questions? I mean, Jeff?
Yeah, so in other words, they're recommending that we increase contributions to the fund by the 17%.
Right, so that
15% of that would be the employee and 85 would be the county having to support that with general fund dollars.
correct,
So it's not, the increase isn't being paid only by the employees.
correct.
And the increase is related to the market cost of the care. It's not the changes that we made, it's anticipated, it's not the changes we made into the benefits.
That's correct. So that's what I kind of wanted to make sure everyone has. These are independent. So if we say, okay, we don't want to leave grandfather status, we're not ready for those changes, that's allowed, obviously, and you stay grandfathered. And then Steve's going to come and say, we still need 17.5% for the claims fund to pay those claims.
Right.
That's correct. Yeah.
And it sounds to me like, Administrator, that if we had 3 years at zero, and if we want to make things more projectable for, the employees and for the county budget, we might want to pick a number like 7 or 8%, but make a commitment for 3 years, as opposed to 17.5 for one, and then go back to, 5% for the following year. We should realize that we've got some catching up to do.
Right. That's kind of the point of Steve's illustration is that, this is where we would like to get to. And the way you're talking, Commissioner, is correct. It's not something that has to be done in 1 year. I mean, there's a chance, it's actuary is, like Steve said, an estimate. So there's a chance that you do, I'm going to make it up, a 10%, and then you have a pretty good year, right? The claims go the right way, not the wrong way.
We can adjust that.
And then you come next year and you come back to the table and the adjustment will almost be built in. Now, that could go the other way where you do a 10% and you have a bad year and the plan was to do a 7% next year and Steve comes out with a 12. But once again, we can have these discussions and because you're self-funded, you can manage it over the years as needed. Actuary just gets nervous because Steve has seen situations where groups have done the 0, the 0, the 0, the 0, and then the bad day comes, and then you have to do a 20% because there's not enough money in the fund to fund claims. And that's really what you're trying to avoid. So there's going to be enough money there, even if you do a 0, most likely, to fund claims next year. But we want there to be enough money there in 10 years.
I think the thing that made me notice most and care about the reserve was that in 22 and 23, those two most recent years, we had zero claims one year, 750 and over. We only had a couple in the 500 to 750, but the 400 to 499, we had a doubling in 1 year. And so I think that making sure that we cover for the employees the most number of things that most of them use or would like to use. I think that's the important notion, and keep in mind that the payment to the reserve is about keeping the reserve up. It doesn't matter which plan we have.
Correct.
And I for one would rather know that we're providing the services that are important to, our employees, because they're citizens too.
And I would call out on table B at the bottom. So I have the terms mega claims and little big claims. Those are the ones that you were just identifying. I would also call out what I've now termed the tiny but mighty GLP-1 claims. Those are the diabetic commercials that you see on TV, the Ozempics and Wegovy's. Those claims are now averaging $13,000 a year. So they're much smaller than a $500,000 claim. But the prevalence of them is what's important. If you get 10 of those, that's 130,000 that you didn't have before. If you get 100 of those, it climbs up significantly. And we've seen that with, I worked with a fairly large self-funded school district in Erie County, and they saw an increase of $400,000 just with the GLP-1 prescription drug claims. And then we also have a pipeline of gene cell therapy drugs that some of those prescription drug costs could be well over $1 million, $2 million a claim. So, and that's one reason we do the forecasting. We use the trends that we do to ensure that we're planning over the next year.
I think the other important thing, and you guys are kind of seeing it in the data, and this is typical of every self-funded group, is you're going to have good years and you're going to have bad years. And in a 10-year, and you guys due to your size, your claims are fully credible. So when Steve does your estimation of claims, due to your group size, it's 100% credible, but that doesn't mean that the pendulum can't shift, 15% more or 15% lower. And over a 10-year period, it usually tends to kind of equal itself out, but on a year-to-year basis is when, you could have the really, really bad year, when the fund really drops, and then you could follow it with the really, really good year, and then you could have the really, really average year. So it's important it's hard, I guess the reason I'm saying this is because it's hard to look at just 1 year or 2 years, because it is going to fluctuate on a year-to-year basis. And then you've got the cost of care behind the scenes, obviously, increasing. As Commissioner Moore said, the doctors aren't lowering the rates anytime soon. So.
And we do anticipate lagging inflation on healthcare because the hospitals are under financial pressure, so they're renegotiating their contracts with the providers or the carriers. Not renegotiating. When those contracts come up, they're negotiating a higher reimbursement to cover their costs. So, while most of the economy was hit with immediate inflation, on the healthcare side, we still, I believe, have lagging inflation.
And I think that in our team, when we put it together and we sat down and talked and had Brad come over, and Steve, you were part of the meetings that we had, is that there were no leashes put on Brad in any way whatsoever. Our charge to him was to have a 2024 plan that matches up to other counties and other facilities, other governmental agencies, so that we don't have 10 or 15 or 20 union members that are here that are complaining that we don't have cardiac rehab. I don't know what the next complaint would be, And I certainly want, this administration wants to take care of everyone in a very fine fashion, in a modern fashion, and so that we don't have those groups coming in and saying, well, we're grandfathered, we need to change it again, and then all of a sudden, we're back here talking it again. So what we did with Brad and Minuteman and Steve is said, team members, let's come up with a plan that makes sense. Let's put it back to the county commissioners in hopes that we can move forward and we don't have our rank and file that are back up here complaining that we just don't have the coverage. It might happen that way. There might be a drug that just comes out that it's $2 million that we might not be able to cover, but then again, we might have to in some other way. So hopefully we can, Casey put together a chart which he'll be able to give you from a 4% increase all the way up to 17.50% increase for not only the family plan, but the single plan, with the plan that in going ungrandfathered, so going to the modern plan rather than staying on the grandfathered plan.
Even if we stayed grandfathered.
And quite honestly, you've heard that the same percentages are needed even if we stay in grandfathered. We're still going to need to increase, and we will not be able to answer all of our employees' needs. We just won't be able to do it.
But one of the questions in a conversation I had today when we received the draft, I think one of the things that we need to remember too is the demographics are not working in our favor. You know, I would wager that the average age of our employee group today is higher than it was in 1998. And much of the cardiac rehab and cardiac health care, that's 25 years ago. More things are fixable and there's more rehab, and those things are more important, I think, to our customer base, or our employee base than they were 25 years ago. So I really like the comment that was made that, you know, times change, the average age changes, healthcare technology changes, and leaving grandfather status is going to allow us to offer a lot more care that's a lot more relevant to a larger group of the employee base. Well, all we heard about was the one employee that wanted a coverage we didn't have. What we didn't hear is about the other 20 that would like to have had that. So I think we're headed down the right path, and I think that our consultant and the administrative team have done a good job of handling it in the right step. And the next step is, I understand, we're reviewing the prescription care and stuff.
Mr. President. Mr. Armbruster, when did, you talked about several meetings that you had with Brad and Steve. So when did those meetings start? When was your first meeting, when you guys all started talking about this?
Well, I'd have to look, but they were several months ago, and we've had
Several months.
conversations since I began. Brad, you were in the office within the first, February. I started February 21st. I mean, and then you heard we knew that the process, we needed to take a look at hospitalization. Casey's been concerned about the 0-0, and I was quite honestly concerned about the 0-0, that knowing that we can't, you just can't. I left a community that we have a percentage increase every year. Never got a 0. I think, well, maybe we did during the COVID. But it's increased. But you go on your first and second, now your third year, it becomes very difficult as to how much money do we have, how much can we put forward and move forward on this.
Okay, so I understand what you're saying. We haven't had an increase in 3 years, and the employees, you know, that's helped them not to have an increase. So this has been going on since February or March. You were hired in February. And
Right.
the first I heard of it, and I know the rumblings went through the building when I asked Brad some very specific questions in the hallway after the meeting, but I would have liked to have at least been invited to attend some of those meetings so I could be up to speed and not have to cram all weekend to figure out what was going on here. And I understand Commissioner Rozell's point that we're going to go from the 80-20 and we're going to go to 100% coverage. But there are employees that are perfectly happy with the 80-20, and they're perfectly happy being in grandfathered status. Leads me to my next question, Brad. I think we've established this already. The cardiac rehab, we could have made that change without coming out of grandfather, yes or
I'm
no?
gonna check on that. I believe so. The other thing is we've kind of been working on this since 2021.
Yes, and I
But
had
you
to
had
go
a lot
back,
of
right.
administrator changes.
Thank you for saying that.
Right,
So
well,
it's
I had
kind
to
of-
go back and
Thank
pull
you
what
very
gave
much
us
for
now
saying that. So
and then
let's,
review it.
Yeah, so it's kind of been from my perspective, it's been an ongoing discussion. I will check with the carrier, but I believe in my notes from 2021, so this could have changed in 2023, and I would be happy to check. I believe at the time in 2021 that change could not be made without leaving the grandfather status.
correct.
But I will check on that for 2023. I just find it interesting that there would be an employee who doesn't want preventative covered at 100% and they want it covered at 80, but maybe there are employees that do want that, I guess.
Well, I mean, we can't pretend to get in every employee's mind, can we, Brad?
That would be
Well, it
scary.
becomes free. I mean,
But yes, I
it's
did
free.
go back and pull the file of the stuff you gave us last time, so.
But yes,
Yes.
that is a fair thing to check for 2023 because the actuary and the numbers are changing on a year-to-year basis. And if you pull out the data from 21, some of the changes have different costs to them just due to changes in healthcare. So I will check into that first thing tomorrow and get back to
Well,
you
I
on
have
that.
one more, Mr. President. When you spoke, Brad, this was a few comments ago, and I brought up to you about having the two different plans.
Yes.
So you did say that is possible, so we could do a high deductible
So
plan
there's
and still keep the
so-
grandfathered PPO?
So
Is that possible?
there's two conversations here. So you can have your current plan. Okay, you can have your current plan grandfathered or non-grandfathered, whatever you guys decide, and you can put a high deductible plan next to it either way. You cannot have your current plan in a grandfather and a non-grandfather. So you can't have an employee pick if they want 100% or 80%. You can't do that. But you can stay grandfathered today. Actually, if you do stay grandfathered today and don't make the changes, it actually costs the fund about $300 and some more thousand due to the changes saving the money. However, you can't have the 80/100 option. You can always add a high deductible plan next to your plan.
But is your
in
figure
either
covering
scenario.
the increase on the?
What was
premium?
that?
Is your figure covering the increase on the premium?
No, these are completely independent.
Correct.
So the changes that were presented on October 31st, if all were implemented together, which once again, they don't have to be, you guys could say, hey, we want to do all those, but we don't want to add occupational therapy. You could do that. Or you could say, hey, we want to do all those, but we don't want to change the ER copay. So if you do that, this comment will change. But if you make all of those changes, there's nothing to do with the premium increase. If you make all of those changes, it is estimated that there will be a decrease in claims to your claims fund of $346,000 if you do those changes. So in theory, if you don't do those changes, Steve's 17.5% increase actually costs people a little bit more because you got to put that $346,000 back into the cost of claims. This stuff's confusing. Does that make sense?
No, it's pretty simple. We have to make a decision as a board whether to stay grandfathered or not.
Yep.
Then the next decision this board has to make is how we're going to try to make up for the shortage, which I think going over 3 years would be a better system.
I think there's still confusion amongst employees. I just think there's confusion that the leaving grandfather I think there's confusion from what I'm hearing, and maybe I'm wrong, that if you stay grandfathered, then Steve's going to say there shouldn't be a rate increase, and the two of them are.
I'm not hearing that at
completely-
all.
Oh,
Okay.
yeah, we're not
No.
hearing that at all.
Okay, I just wanted to make sure they're
You can
separate.
stay grandfathered as long as the increase is less than 5%.
Is your increase affected by grandfather status?
No, as
No.
long, you can increase the healthcare premiums,
As much as
as
you
long
want.
as it's under,
Yeah.
you can stay grandfathered, you have to be under 5% a year.
I don't think that's true.
That's-
Steve?
Yeah, I don't,
No.
We had a 6.7 in 20.
Yeah, I don't think that your premium increase affects grandfather status, but I'd have to do a triple check on
So
that.
you're saying that we could raise rate 17% and still not get kicked off of grandfathered status? Because that
Correct.
wasn't what I found out.
That's
when
correct,
I
because
did
you
the
have to
research.
manage the funds. I mean, I'll double check that. Have you ever heard that? I think that's correct. Yes.
Okay. And then, and again, Casey, you'll drill down on that $6 million number for all three of us, and maybe get us an email with some information on that?
Yeah, we'll work together as a
Okay.
team and see if we can get to the bottom of
Because
it.
when I looked at the numbers from 16 on, and let's just say for 2018, we'll just start there. Our cash reserves in 2018 were 13 million, then 19 were 16 million, 2020 was 21 million, 21 was 22 million. In 22, we were very healthy. We had 26 million in our cash reserve. So we're now dipping down in that 19 to 20 number. We stayed pretty consistent for, about 4 years there. So this was a big difference. And as a commissioner, I think my fellow commissioners would like to know too, besides the cost of just the healthcare going up, if there's anything or any anomalies you can find in there, and let us know.
Absolutely. We'll dig in that and see if there's any dots to connect.
Okay, great, thank you.
In closing, I just want to say the administration and our team and Brad is that we wanted to be competitive with other governmental agencies, other education facilities out there. We wanted to bring it to a 24-year modern time, and we addressed as much as we can through the process and bringing in all the modern things into this, taking it from 80 to 100, and then adding on the additional items in the second page on your occupational therapy, which most everybody enjoys, your cardiac rehabilitation, your emergency room copay. I don't know of anybody that's $250, $300 that's not at that number, and certainly not at 25, costing us $403,000 a year to go to an emergency room for a cold. And then turn around and then you added chronic condition management when you got diabetes. A lot of us have that, maternity, asthma, COPD, and heart management. There was no leashes put on these fellows over here. And the only leash that Steve's got is that actuarially, he's getting older like me. And there's less and less of these guys out there. And I said, I take my hat off to you because you've done an excellent job in the past. And I think that you've projected it out right, because if you look at historically, you're the guy that's done it, right?
Okay,
Mr. President.
okay.
One last comment, commissioners.
I've heard one last comment 40 times tonight.
I'd like us, I hate to keep saying I'm the new guy, but I'm the new guy.
Not anymore.
So I really don't want to worry about how and who and when dug the hole. What I want to hear about is how we're going to fill the hole and how fast. And I think that that's what we heard tonight. And I, for one, Commissioner, I want our team to do their job with our consultants because they're the experts in the field and we set policy. Do we want to fund the fund properly or not? Do we want to stay grandfathered or not? That's a decision for the three of us. All the rest of these decisions, in the marketplace come from the consultant and our staff. And all I can tell you is, as a small ex-employer, 10 to 15% over the last 5 years increase per year in hospitalization. We are very lucky to be self-funded and have the controls in place. The people who pay their taxes in this county don't have it as good as we do.
Used to be when you worked for government, people did for just the health care.
Right.
And that's why people came to work and stayed. And I see this more as a tool to retain our employees.
Gain and gain.
And thank you, and gain our employees. I spent the night in ER all night with my mother-in-law all night, so that's why you see me with a little bit of drag tonight, and saw firsthand our health care. And I'd like to do a shout out for the Cleveland Clinic and over there in Avon. It's amazing what our healthcare providers are doing and what they have to put up with. What I saw last night, just, not enough beds in a hallway. People shouldn't have to see. So the decision that we're going to be making is what I stated earlier. We're going to have to decide as a board whether or not to be grandfathered or not, and how we're going to pay the 17.9 if that's the number. And I think it sounds like 3 years instead of 1 year is the way to go. And we'll probably be making that decision this Friday. Will you guys be able to come back on Friday in case anyone else shows up on Friday? And maybe we can have some more discussions, maybe to help us with making that decision this Friday?
Not a problem.
Is that okay?
Is that in the morning?
Yes.
It'll be at 9:30 in the morning. And
You'll be home in time for dinner.
I don't know.
My kids were wondering where I was tonight. I said, I gotta work.
Yeah. I do appreciate you guys coming in this evening, and I thank you for coming in tonight, and we'll
you.
hopefully be able to take care of this and finalize it on Friday. Thank you. What else, Mr. County Administrator?
Sorry for, this was a long discussion, but yet we've got.
It's a needed discussion.
Neither one. And we've got another one, another cost savings. Casey and Captain Ashdown from the, Casey's from Enterprise Rent-A-Car. And Captain Ashdown, obviously you know who he is, but they've got some really good cost-saving things going for the Sheriff's Department. And Casey, if you could make a presentation. Thank you.
Good evening. Thank you for having me. I'm Casey Krupko. I'm an account executive with Enterprise Fleet Management. Some of you have heard a little bit of this presentation before, so some of you might see, but it's going to be a good refresher, and we're going to see the cost savings that it has for the sheriffs. Can I control this? The next
They'll do
page?
it back in the
Okay.
back.
All right, so if we move to the agenda, last time I could. We're just gonna go through a list of, thank you, perfect. References, and then the items we can do for account management, talk about our account team here locally in Strongsville. I have an example of state contract comparison, how prices have increased over time, showing our funding options, and then lastly, showing the difference in cash flow from the current model the sheriff's doing to what we're recommending. These are a few references. If you have anyone on here you'd ever like to speak to about the program, of course, reach out to us and we can provide those contacts. And then these are all the different items we can do from a fleet management standpoint. It's very unique we tailor it to what makes sense for our clients. So not everybody does all these things, but we really do everything from acquisition to resale, and then all the operational costs in between, we help manage those as well. This actually is a photo of our team. Again, we are local. We take a lot of pride in that. Our meetings are held in person. The sheriff's office would meet with us a minimum of two meetings per year. The one meeting would be comparing year-over-year costs to make sure that we're hitting our numbers and seeing if we need to improve in any areas. And then the second meeting would be preparing for the year ahead and getting any vehicles on order that we anticipate should be cycled, and then pinpointing what vehicles need sold as well. Any questions so far? And then this is just a very simple example. We have had a lot of different people coming to us lately to see our different funding options, just because vehicle prices have increased so much since 2020. This has made it very difficult for different capital budgets because it's not the typical budget you used to set 3-4 years ago. As you can see, it is pretty drastic from 2020 to 2024. This is the newest state contract, and this is a similar vehicle, and you can see how much it's increased over the last 3 years. These are the two different funding options I actually presented to the sheriff's office. We essentially are a bank. You can pay cash, and you can also do our equity lease. I don't like using the word lease. It's not a lease. It's essentially, the best example I have is you're buying a house. You pay that house down to a residual, and when you sell that house, what equity's left in it, that becomes the sheriff's office at that point. So there's no wear and tear, there's no term penalties, there's no mileage penalties, there's nothing like that with this lease. From our analysis, we found the police vehicles should be held for about 60 months. And in this example, it's showing the Durango Pursuit, and it shows the initial vehicle cost, what we anticipate the resale value will be at 60 months, and the reduced book value, and then at the bottom, you'll see estimated resale, and then to the right, the estimated equity from the lease.
Is that mileage right? Because you guys put a ton of mileage on.
They took an average of everything from our admin vehicles to our daily patrol vehicles. So that ends up being about right. Our vehicles that are in patrol every day are probably averaging closer to 20 to 25.
Okay.
So what
That's
we
what I was
do
wondering. I
is-
thought, man,
yeah.
15,000.
So we do monitor it, and there are some, if they're driving 20, 25,000, we
Yeah.
would come to them and say, probably not 60 months, we're gonna look more at 48 months, but that's a ongoing.
But isn't that per vehicle, like if it's going to be on a road patrol versus an admin vehicle?
What was your question? I'm sorry.
Well, no, that's going to depend on which automobile or which officer or which, if it's a deputy on the road versus an admin.
Yes, so that's something we just have to monitor.
So is that going to be a separate type of a financial arrangement for that vehicle?
We would still put them on the equity lease,
Oh, would
just
you?
based on the initial cost up front.
Okay.
Because especially police vehicles right now, they're hard to get
Right.
right now, and they're also extremely expensive. So it just helps from the capital standpoint, rather than putting up, and this initial vehicle cost is invoice. This is what we pay for a vehicle. But if we were to go outside of invoice, you're gonna be looking well over 44,000 right now.
Okay, thanks, sorry.
No, it's
Messed up
okay.
your routine there.
It's a good question. And then the last part of it just shows the cash flow difference. Right now, over the past 10 years, the sheriff's office has been purchasing about 10 vehicles a year, which if you're paying cash like they've been doing, with the numbers we're expecting, that would put the capital budget, and this is without their upfit, this number up top. It would be about 481,000 for the capital budget expected. If we go to our plan below the equity lease, we're saying to replace 15 vehicles in the first year is what we have recommended. That puts your budget on our lease at 155,000. So the difference in cash flow alone. And then at the bottom, I also have a year 2 replacement in here as well. And the reason being, right now, the vehicles that we can order for police currently are the Durango that they could get. We're expecting Q1 of next year. However, Ford Interceptors, you can also order. However, they will not be built until 2025. But we are telling all of our police clients to put the order in, or else you're going to miss that window come next year, and you're going to have to wait till 26.
Okay.
So this is technically 2 different budget years that we're looking at. And then I also put in here the estimated equity at term that we anticipate from being on the lease plan. That's it.
Yeah, and I think when the sheriff sent over his anticipated budget for next year, we had built in the car proposal for next year in those costs that we estimated. So that $481 or $481,000 was just for the vehicles alone. We also know that we had to build in about $10,000 to $15,000 in upfit. That's the MDTs, the cameras, all the other equipment that goes in it. So we're looking at $560,000 to $600,000 that we were asking for next year for 10 vehicles. So this is 15 vehicles plus another 16 the year after that for a fraction of that cost.
And this doesn't.
Maintenance would stay in-house with us. They have software that Grant would input all that information. And like she said, their team would meet with us twice a year to look at those. Maybe an admin car is at 5 or 6 years, but we've got a car that was getting burned up in the fleet. They make that recommendation to replace that one over the admin car.
Yeah, this is really honing in just the capital budget, but the thing I don't highlight in here is the operational piece as well. If we are cycling these at the point we're recommending, there is a cost saving there that's not even in this analysis yet. But when he starts using our software for maintenance, that is real-time data that we have and we like to utilize because that helps us make real recommendations for you as we go, for sure.
Fantastic.
Yeah, the other benefit of this is you guys know I've been coming up here for the last 4 or 5 years doing cars every year. One entity, we just don't have the purchasing power like she's able to do for us. You know, I have to scrimp and search all over the place to put 8-10 cars together where it looks like they're gonna be able to do well above that with no problem. We're still waiting on a car from 22 from Chevy that supposedly it came off the plant floor, but they can't locate it.
Do the figures that you're discussing in the model, do they include the upgrades, the specialty equipment that's required by the sheriff?
So in this particular analysis, it is not in here because I was trying to do an apples to apples. However, we did make another 10-year budget analysis and it was calculated in that one for the, I believe we put 15,000 in there to be conservative.
Just out of curiosity for past practice, since you've been doing it 4 or 5 years and I haven't, the extra equipment that we put in the vehicle, is that something that gets taken out and put in the new vehicle, or is that basically exhausted at the end of the lease and?
Usually it's pretty close to being burnt out because you're looking at an MDT, a camera, things like that, your electronics. At about 5-6 years, we're looking to replace anyways. We've actually been running the cars closer to 8-9 years, and we've had camera failures, computer failures, where we've had to replace those in the cars currently. So we're looking at basically every time we build a car, it's all new equipment every time we build a car.
I would anticipate that, but I wanted to be clear.
Yep.
Thank you.
I would just like to say that, we started this with Karen and the administrative team over here when we did the maintenance vehicles and with the trucks and Enterprise was there. It kind of brought them with me from North Ridgeville because it was a test and it worked out very well over there over the last several years. And then bringing it to Captain Ashbaum, taking it back to the Sheriff's Department. This is the first time that I tried to get that done, but I think that it's excellent because when we get a new car in, it's going to come with all the new equipment. And that was something that we really wanted to do rather than try to change everything out, have our mechanics do all this kind of stuff. You're still going to use the same people to develop what's in the cars. You can use those vendors. It's not Enterprise that's doing it. It's actually the vendors that you've been dealing with. Is that correct?
Correct.
So these are trusted vendors, local guys that we've been dealing with for the last several years that are actually getting into the action. And the cars themselves can be delivered actually through one of our local dealers, I believe. Is that right,
Yeah,
Casey?
we'll deliver them to the local dealer to support the community. I know Elyria Ford is an option, and then we have the one for Durangos as well.
It's just another way the administration maybe can fight through the political wars that we have and be nice to one another every once in a while, right, Captain?
I'm looking forward to seeing how this works out.
Keep it local. Keep it local.
Far less invoices this way.
Well, Captain Ashdown, you probably spent a lot of time tracking the cars, finding the cars, tracking them, ordering them, and all of that. So how much time do you think this is gonna save you?
This is gonna save us a ton of time. Grant and I work on this. We usually it takes us about 3-4 months of pulling the data. I'm monitoring monthly mileage on every car every month. So it's an ongoing project year round.
So I'm done. And
Okay,
but-
well, thanks for
hold on.
coming in.
Karen has
Thank
some.
you.
Good afternoon. So I just wanted to give a quick update on our Job and Family Services building. As you all know, we had the great 800-year flood over there. So we are now in the process of installing the last bits of carpet. So we should be completed with the restoration work by the end of next week. And they're also installing or reinstalling the cubicles that we had to remove from the location. So hopefully the employees should be back into their previous workspaces. And they'll be out of the hallways and the lobby and doubling up and tripling up over there in the offices. So I know they're excited about it. I'm excited to get it done and over with. Mr. Armbruster asked me to remind you that we are going to be presenting on Friday, I think, as part of board business, a requisition to hire a company, Desmond, to do a space study at our Job and Family Services building. So you'll see that on our board business on Friday. That's it.
Okay.
Clerk.
We have a proclamation for November 15th as American Recycles Day. Brandy?
Brandy wants to read it, or, no, come on up.
Hi, Brandy.
Howdy.
Hi, good evening. I'm Brady Schnell from Lorain County Solid Waste Management District, and I am here today to get the proclamation where we proclaim November 15th as America Recycles Day in Lorain County. It's meant to focus attention on the importance of recycling, and it is something that we have celebrated and taken part in for many years here in Lorain County. So I always appreciate the proclamation, and we have some events set up tomorrow. I'll be at Lorain County Community College talking to students, and we also have at the Carlisle Visitor Center with the Lorain County Metro Parks, there's a display up for the month of November. They've always been a great partner, and so has Avon Lake Public Utilities Department, or Public Works. They donate a rain barrel that we raffle off for everyone that participates in America Recycles Day and takes that pledge that they will learn more about recycling in their community and try to do better at recycling. They're entered into a chance to win that rain barrel. So those are a few of the things that we are doing to celebrate that day here in Lorain County.
We had a policy committee meeting today. It was
did.
very eventful, I would say.
It was the quickest policy committee meeting I have ever been a part of
Yeah.
in 18 years.
And it was also the first time that we had 100% participation, would you say? Approval
Yes.
of the,
Solid waste plan
Yep.
had 100%, it was ratified by 100% of the political subdivisions
of all our
in Lorain County.
communities.
Yeah,
Yeah.
every single one
Yep.
returned their resolution approving the Lorain County Solid Waste Management District Plan, and that is pretty exciting.
it was not front page news, but it was very telling of the work that your department, Dave and your department are doing. Not knowing, but we also have one of the largest collection centers, not only in the state of Ohio, but in the country.
Our
ahead.
collection center is definitely one of a kind to have our own employees, to be open year round, 3 days a week, full service. Our workers get the items out of your vehicle for you. It's no cost to Lorain County residents to use. We take a lot of things from Lorain County businesses as well. And we received an award some years back, a national award for that collection center.
Correct. So I just want to pump it up. Nobody ever shows up to those meetings, but they are. It was a good meeting. It was something to be proud of. So I want to thank you. And we do have a proclamation here. I'm not going to read it. It talks about recycling in the whole country and what the benefits are. 681,000 jobs. But the fact is, Lorain County is leading the state of Ohio by having the largest collection center, and probably one of the largest in the country. And you guys are doing a great job. So this is more, even though we have a proclamation, really, you guys are doing a fantastic job down there. I want to thank you.
Thank you. Yep,
Yeah.
Director Blevins is leading our ship, and he's doing a great job, and we're really proud of the work that we're doing, and to get 100% ratification on our solid waste plan, big deal.
Yeah, so basically, it's in the matter of proclaiming November 15th, 2023 as America Recycles Day in Lorain County. And I'm not going to read the full thing.
That's okay. It's
thank
a lot
you.
of words.
It's a very long
You got the
proclamation.
important part.
Yeah, that's the main thing. So thank you for sticking around.
Yeah, absolutely.
Okay.
Should I just come and get it? I don't know.
Oh, no, well, okay, here we go.
Pass it down to you.
Okay, thank you.
Okay.
I appreciate that.
Okay, board correspondence.
Move to waive the reading of the board correspondence.
Discussion. Commissioner Moore.
Aye.
Commissioner Dell.
All right,
Commissioner Hahn.
Yes.
Is there any new business?
Don't see any.
Did we waive the lobby session?
What?
Isn't it a lobby session?
It's right here.
Oh, it got cut off on mine.
No new
Oh, there it
business?
is. No, it's on the other.
No new
side.
business,
There it is. Okay.
And then public comment.
Okay, public comment. Adam Shaw? Yeah.
It happened.
Good evening.
Good evening.
Adam Shaw, President of the Lorain County Deputy Association. It's been a while since I've been up here. It's kind of been nice, but here I am again. 22 to 23, our healthcare fund had a cash balance carryover of $26.5 million. 23 to 24, we're projected about $20.5 million. Since 2017, that fund has raised from $12.2 million up to $26 million. In 2017, we were ordered by the state auditor to lower that balance, which was at $16 million. And now we're well above that again. Why is there a $14 million increase over those couple of years to where we are now, and now we want to raise our costs even more? Most third-party administrators of plans require a 25% carryover, which would be about $11 million for us. You guys know what we require? Okay, perfect. So we're sitting about 50% over what is recommended by most companies. My other concern is Minuteman HR, I don't know your name, I'm sorry. Brad was a campaign donor to issue 20, which both you and Commissioner Moore happened to be a part of and started. Now they're making recommendations for the county when they gave you guys money. Weird how that works. If it's not broke, why are we trying to fix our insurance? It's not broke. It works just great. People have throat cancer. You guys have the ability to make that determination whether we pay it or not. The same as people with heart issues. We're self-insured. They sat here and said it. You guys can approve and disapprove whatever you feel like it. Here we are making excuses of why we're going to jack costs up. I'd like to comment, Brad said multiple times, it's 80 to 100, 80 to 100. That's cool. About $100 a month premium increase per paycheck per employee on a family plan. That is $2,600 a year. Additional, our out-of-pocket maximum is currently $1,800. Where's the savings, Brad? Exactly. So
Okay,
you want to
thanks.
increase stuff. We're talking all these increases, 17.5%, $100 more a paycheck. You're zeroing out our raises. All the raises everybody's got are gone now if you do this. Cutting ours in half by 50%. Are you guys willing to sit down and renegotiate all of our CBAs for more raises? You going to do that too? You're opening everything else up. Are you going to commit to renegotiating our CBAs? Probably not.
Okay.
Again, why are you waiting until the end of the year to do this? Been meeting since February. You sprung it on all of us, including the other commissioner, surprisingly. Hey, employees, here's another screw you.
Okay, you're over your limit by. That's
fine.
okay, but I appreciate you coming in tonight. Thank you.
My other concern is.
Well, you get
Well,
2
that's fine. I
minutes.
just want to give you one more thing. Okay.
Oh, that's fine. Go
A
ahead.
17.5% increase. This year, we brought in estimated $40 million in revenue in our healthcare fund. A 17.5% increase will increase that by $7 million to an estimated $47 million in revenue in our healthcare fund. And you guys just want to keep
Okay.
jacking it up. Why do you guys want to ruin this county? You've done nothing good. You bought them all. You're screwing us with Mark's radios, apparently, from rumor running around now. Tomorrow, you're going to make the announcement that we're all getting Marks. Everybody else is going to Harris. You guys have done nothing good for this county at all.
Thank you.
Appreciate the work you guys do.
Yep. Okay, Aiden, you might as well come on up.
I wanted to comment on
No, you're coming up.
presentation and agenda item, or was that?
No, that was a
Okay.
public
I
comment.
just had a question.
Sure, Aiden.
Can I ask a question about the health, or is that going to count for my 2
Well, your
minutes?
2 minutes is going, so.
All right, well, I haven't started yet. So my condolences go out to Jeff Riddell on the absolute annihilation of his 7 districts planned pipe dream. Including the $80,000 of county taxpayer money to notify the electors, you outspent us 15-1 and still got beat 68% to 32, without winning a single precinct in the entire county. Oberlin voted 5-1 against issue 20, Sheffield 3-1. Thank you to all of the people that helped educate the citizens of Lorain County and shut this nonsense down for good. Dave Moore, we couldn't have done it without you. It was your friends who helped the most by motivating us to get out and take action, and by none of them showing up to help at all. Nobody helps you. Nobody. None of your supporters or so-called friends. It made it that much easier for us to defeat it. Not one single person who claims to support you came out to the Board of Elections for early voting or at any of the polling stations to support or campaign for issue 20. This was a moratorium on what's to come in 2024. Now, if you raise the health care premium 17% over 3 years, will employees receive a 17% increase in salary over the same period? Job and Family Services is already short 50 employees. With this plan, there is no way the county can attract new workers or retain the current employees. Maybe a primary time strike is in order. Why not allow the employees to vote on any changes to the plan?
Okay,
Thank
thanks, Aiden. Debbie?
It's been brought to my attention that there was a discussion with the administrator, Armbruster, in the city of Elyria. In that discussion, it was stated by Armbruster that he was disgusted with the city of Elyria because their radio system pick is not the system the county is going with. How does Armbruster know what radio it is? He must have ESP, Magic Ball. Sounds like a little bit of inside information to me. And there's also speculation that Armbruster himself is prohibiting CCI from integrating additional Harris equipment and blocking their employees from access at 911. Thus lowering and prohibiting other government entities from utilizing the equipment they want to purchase and use. And it's not Marks. Apparently, you guys are already set on Marks. But I'm here to tell you, you go with Marks, none of the first responders want it. They're not going to use it. Cities have already purchased their own Harris systems. So what is in it for a Mark system for all three of you? Got to be something there. Otherwise, you wouldn't be going for it. So, with that said, I just want to say issue 20 is just what's going to come in 24 for you more. It's just a start. Anybody that's associated with you, going to get the same thing. We're going to be working the ground and everything else. Thank you for letting us defeat you on 20.
Thanks. Mike DiCarlo, come on up. Hello, how you doing tonight?
Evening, Mr. President, Commissioners, Michael DiCarlo, 320 Alberta, Vermilion. I guess maybe I should have put a yard sign for issue 20 in my front yard. Next time I'll ask you for it. Well, anyway, came up here to continuous process improvement in a more perfect representative system, to be critical of it, but not to burn it down, right? The radio system that we're talking about. I watched the meeting when it was passed, and I heard the sheriff the last meeting. The fiscal year starts on what day this year, Mr. Armbruster? The 17th, the new fiscal year? It ends on the 16th of December?
January 1st.
Correct? All right, so this fiscal year started on December 17th. No?
January 1st.
January 1st. So where's the gap there? How are we only going, this fiscal year ends, when does the next fiscal year start? On the January 1st? Or?
Yes.
We're a calendar year.
Yeah.
Your calendar year thing? Okay. So what I'm trying to say here is that the prior board, even in its good intention, spent your money, Mr. Riddell, that you were elected to oversee by being elected. And they did it, it seemed like it was a special meeting or something. Mr. Moore wasn't there, you were ill, there was 2 commissioners. But it was the very last meeting of the fiscal year to spend $6.6 to $7.7 million on a radio system that the people, not the people, but the government employees who are first responders, but separate. You have the fire department under commerce, and you have the police department or the sheriff's department under penal code. Combining commerce and penal code together with government employees is like suicide if you're a regular citizen. We're getting it together. Those are 2 separate entities. Fire department, commerce. They're there to do what? Protect our property and the commercial property. Everybody should be equal under protection of fire. But yet, the buildings that were built recently are gigantic buildings, right? Mostly commercial buildings. So therefore, the citizens are on the hook to pay for this radio system to benefit the commercial properties, and it benefits the citizens none. It's commercial welfare. At its base core, commercial welfare. And I do it at the very last meeting when there was like 30 things up there. Just like a wish list, hurry up and pay all these people that, up there, and at the very end, the radio system. Apologize for.
You're good. So thanks for
Going
coming
a little
in.
bit over. I
Yeah,
hope that
you're
made
good.
sense.
No, well,
I mean, because to me, the way I looked at this is that they were spending
Okay.
this year's fiscal money last year in the very last meeting
radios.
for something that
Yep.
radios work. There's nothing in the environment that's changed.
Victor.
Excuse me.
Yeah, one more.
Have a great week. Sorry, I won't
Thanks-
see you
thanks,
Friday.
We'll see you
Gotta
Friday. Oh,
be-
you got another chemo Friday?
I got another chemo. I got it Thursday this week, but I have a surgeon on Friday morning. So
Okay, well, good luck.
I'll meet you. Right on.
Yep, good luck,
And,
sir. Okay.
Have a good week. See you.
Okay. Victor,
We have one of our own.
we have the guy behind the curtain that wanted to
the
come up and
wizard.
talk. So this is, if you're always wondering about who's doing the videotaping, this is Victor Edwards.
Mr. President, Commissioners, good evening. I, Victor Edwards, am a resident of the city of Lorain, and I come to you with a concern I have about yard waste collection. You see, I recently found out that Republic Services has changed the way they collect our yard waste, and they are now combining the bulk trash collection with the yard waste collection. Last week, I called Republic Services to ask them about this, and I spoke with a supervisor there. His name was Chuck Alamong, and he confirmed this is true, that that one truck that collects both those yard waste and bulk collection goes to the landfill, the garbage dump. And I guess the question I had, or the concern I have is, we have a large company like Republic Services who doesn't seem to be in the best interest of recycling. And I had some questions on why that might be. Republic Services operates a bio-waste power generation facility at the landfill where they basically take the byproduct of decomposition, natural gas, and they sell electricity. Also, by reducing the number of collections, they save operating costs by reducing the number of vehicles on the road. I know we have a solid waste district, and we have county employees who are paid to help promote responsible recycling. But I'm just concerned because municipalities like the city of Lorain are still telling their citizens that we should be recycling responsibly and using biodegradable paper bags to collect our yard waste when it doesn't seem to make much difference. So I guess in conclusion, I was just curious what oversight or authority the county and the solid waste district has over companies like Republic Services.
Okay, well,
That's
thanks. Okay, thanks. And that's the gal to talk to right there.
Earlier.
Right after the meeting, why don't you,
Talk to
yeah,
Brandy.
talk to Brandy. Okay, that's it. So,
Mr.
yeah.
President, can we entertain new business for just a minute?
Oh,
I know
okay.
we passed it already.
I thought you had to go bathroom, that's what you
No,
thought.
no, can I bring up a topic,
Yeah.
even though we passed new business?
Yeah.
Thank you to my colleagues for that. I had the chance to attend the Rochester Township council meeting last Monday, and they were going to send a representative from council tonight to speak. Hopefully, maybe between the engineer's office and Karen's office and deputy administrator's office, to speak to you all about 1 square mile that they desperately need help with and snow plowing in the winter. They usually will, she said they pay, but they have nobody that's answering any of their ads, and their person who's been doing it for years and years is retiring. They were gonna come here and bring it up, so on their behalf, I'm bringing it up if my colleagues would entertain them calling and having a conversation
Oh,
with you.
I thought maybe you were gonna run a commercial for
No,
snow
no,
plowers.
They literally have 2 streets, and they
Yeah.
can't get somebody to plow them.
That's a Ken Carney discussion, or what?
Depends on where it's located.
She said they literally see the county trucks driving by,
Depends on the street.
but
The
they
county-
don't drop the plow on their streets.
The county will do the county streets, and the state, Bob's here, but the state does state streets. I don't know what else. I'm looking at the map of Rochester Township right now, there's not a lot of
And
streets.
she literally said it's 2 streets, and the county truck will drive right by it, so,
Just have them get a hold of me.
okay, I'll tell me, I
Okay.
will relay to Mayor Cindy to have her
And-
give you a call, Bob.
And I'd like to have Mr. Petticord, if you'd like to give an update on the solar alternative energy and how that's moving along, because I was hoping to have this wrapped up by the end of the year, but it looks like
Well, we've done,
that's run to new business, why not?
okay, we have
Yeah.
what Commissioner Moore is referring to is the there's a law change we talked about a couple months ago that allows this board to take certain steps to prohibit large-scale alternative energy plants or facilities from the unincorporated areas of the county. This is an issue because under prior existing law, at a certain size, townships and unincorporated areas couldn't really zone to protect against windmill farms or solar farms or things that they maybe didn't want in the township. As the law changed, we talked about it a little bit at the township meeting. We talked about it here at the Board of Commissioners, I want to say 2 months ago. In that time, my office has researched the law. We've drafted a stock resolution for the townships to pass if they'd like to participate. And an explanatory letter has went out to the townships. The idea is to get, and the hope is to get input from the townships themselves to see what makes be suitable for Rochester Township as opposed to LaGrange, as opposed to anywhere else, and let the townships have a voice in what this board would ultimately pass in a kind of cafeteria-style plan. To date, we've heard from a few townships, nothing specific. My plan is Thursday at the township meeting to raise it again with them. If I'm not there because my boss has a fundraiser and I probably should go to the fundraiser. If I don't finish the fundraiser in time, Jacob or Greg from my office will be there and we'll talk about it at that point. So.
Okay, well, this is,
You see him every day, don't you?
Who, the township trustees?
Oh.
Your boss.
I was making a joke, but I'm gonna go to JD's.
didn't go over too
It's
well.
late, yeah, it's late. I'm going to JD's fundraiser. If I
Yeah,
finish in time,
well,
I'll go to the
that's
township
yeah,
meeting.
that's
If
it.
not, Pels will be there, yeah.
Quit marketing it. Okay, well, the thing is, what's going on is at Eaton Township with the ash issue.
Yeah.
They're operating that in more of a reactionary, and we don't want to be reactionary.
Well, yeah, and a part of that, I mean, the expansion to the incinerator plant at Eaton Township is not gonna be covered by.
I know
change
that,
in
but
law.
that's just an example of us taking the initiative to allow township participation.
And part of the problem that
Yeah.
you and I have talked about is a lot of times with the townships, they are reactive because they're not maybe full-time and paying
Correct.
attention to it, and we're trying to get this to the top of the agenda. And then, Brian standing here, recognize that once there's input from the townships, there will be a statutory process that will have to go forward at this level that will require public hearings and require input from concerned citizens of the county, both pro and con, before this board can make any type of decision as to what it is the board chooses to do in those
Right.
unincorporated areas.
Okay.
Is that better?
Yep.
Yeah, okay.
Thanks.
Hey, since you went to new business, and that's like you went out of public comment, can I speak on this issue?
Well, we're going to have a lot of time on this issue. All I want to do is let the public know, or really the townships know, they got to get with him. If not, we're not going to move forward until I get participation. If no one's going to participate, that's kind of what this was all about, so that's
How can I
okay.
get a copy of what you sent to the township, just so that?
Well, he's working on that,
we
right?
are prepared,
Right here.
so
Yeah, he
I'll
can.
get with you, because I want a copy,
Right.
so that if we're gonna come here, we at least know what was sent out to the
Exactly.
townships, so that we're prepared. okay?
Yep. Okay,
Yeah,
thanks.
I mean, yeah, it's not,
Okay, well,
It's a work in progress.
yeah, we are adjourned. Thank you all for coming in tonight. Appreciate it. Sorry it took so long. There you go. Uh-oh.
You're still on.
Yeah, you can turn this off there.